3.
Hi, we are Paola Aguilar, Carolina de Fillac, and Carol Gonzalez. Our presentation was Oral Manifestations and Oral Care for Diabetic Patients. The contents are the following: Compass community information, general information, objectives and goals, AFPI process, evaluate survey, and references. Compass Community Health is the program that we chose. Their mission is enabling health through healing, hope, and wellness. Their vision: no obstacles to health. Values: people first, excellence, compassion, collaboration, diversity. Their languages are Arabic, French, Spanish, and English. The programs and services: client resources, primary care, mental wellness, rehab and food care, managing your health and wellness, community health promotion, and pathways to education. Our contact information were Robin Bernardi and Sonia Pekic. As general information, the target population of our program was the staff members of the diabetes program and food care program, and indirectly patients attending the diabetes program at Compass. The institution, as I said, is Compass Community Health, and our objective of the program is, by the end of the educational plan, the members of the staff of the diabetes program at Compass will be able to obtain new knowledge in oral health and oral health care aspects related to diabetic patients to close the possible existing gaps that will affect healthcare education given to the patients attending the program. Goals: the staff members, which are the learners, will be able to or were able to recognize different oral manifestations of uncontrolled diabetes, differentiate the appearance of oral infections in order to make referral to patients to the dentist or oral surgeon, identify and differentiate gingivitis from periodontitis based on oral signs and symptoms of patients, educate clients on oral cancer screening technique, educate patients on the different techniques or over-the-counter techniques and aids to improve their oral health, recommend clients in some cases over-the-counter products that can be useful for some conditions. For example, mouth rings without alcohol for clients with xerostomia. Recommend clients with some alternatives of aids for oral self-screening if needed.
Okay, so we'll continue with our presentation about ADPI process and our assessments. Our target population initially was chosen for the diabetic patients that attend to diabetic program at Compass in Hamilton. So due to COVID-19 situation, this population was changed to the staff of the diabetics program in order to deliver the educational program online. And the staff can deliver the education to the patients. So to access the needs of the population in order to address them in the planning stage, we contacted the director of the health and wellness at Compass by email, who directed us with the diabetes program coordinator at the clinical director A Zoom meeting was held with the clinical director for an interview and gather information to assess the needs of the target population, healthcare providers, and patients. At the same time, a search was implemented to gather information about the common oral manifestations, signs, and symptoms for individual experiences in uncontrolled diabetic condition, diabetes medication side effects, and dental care recommended to diabetic patients. Now, diagnosis. With the information gathered during the interview in the assessment phase, the following information has been collected. Gaps of oral health knowledge among, among the healthcare providers that are involved with diabetic patients. Need to the distribution of oral health information among the patients, barriers to oral health care detected among patients' populations were financial burden, low income and homeless individuals, language barrier, newcomers, immigrants, low health literacy, new knowledge about alternative aids to perform oral cancer screening or over-the-counter oral self-care for homeless patients. Continue with our ADPI process, the planning. During the planning stage, we identify those human needs among the community that needed to be addressed in order to help at the same time the members of the staff to fill those existing gaps in oral health knowledge, as well as the patients to improve either their oral health literacy and oral health conditions. Based on the data collected during the assessment stage, we designed an implementation plan, including different activities that involve both members of the staff and as well as the patients. As part of our implementation, we found that one of the main actions to be implemented was educate healthcare providers in oral health that are providing care to diabetic patients. In this way, the information will stay with those individuals that are educating different patients every single day. In order to make the information effective, a video was recorded to be delivered by email. This video contains the presentation with educational information and it was sent to the program director to be distributed among the members of the staff because it was very difficult to organize a Zoom meeting with the majority of the members of the staff due to their busy schedules. In that way, it will be easier to each healthcare provider to watch it at their most convenient time and to keep it in a store place in case there will be need to refresh the information at any time. This video will be posted on Campus website to be watched by any patient, making this information accessible to the community. In our presentation, the following topics were included. First, what is diabetes and statistics of diabetes in Ontario, common oral health manifestation of diabetes, oral manifestations of uncontrolled diabetes, oral self-care and recommendations for diabetic patients, alternative oral health care aids, dental care specialized over-the-counter products, cardiogenic and non-cardiogenic foods, denture care and oral cancer screening. Another implementation was the design of a brochure that included basic oral health and diabetes information. With this brochure, this educational information will be accessible to the patients attending to diabetes program at Compass. In the brochure was included the contact information about dental hygiene care service at Southern Ontario Dental College, which may be convenient for some diabetic patients that doesn't have any dental insurance coverage, but are interested at get dental hygiene care. Part of the implementation was the donation of 4 of half boxes of toothpaste samples in 1 box of toothbrushes that Southern Ontario Dental College kindly facilitated for us, and that will be distributed among to the patients.
Our evaluation. During the process of developing this community implementation program, we were evaluating every single stage of ADAPI that was implemented to reach the goals and objectives that were created at the beginning of this project on the 3rd semester. This evaluation revealed the different areas that needed to be improved, as well as some of the limitations that were found during this process. The first one, COVID-19 has been one of the biggest limitations that have found, but with the help of the technology, we overcome this limitation with some changes of some aspects that were since the beginning. For example, we had changed the target population that at the end resulted in a positive change because now we educated not just the diabetic patients, as well we educated the staff members that are in contact with the patients in a daily basis and educating them as well. Another obstacles that came up are not enough time to get every detail organized, especially from the community program side due to busy staff schedules that did not coincide with ours. There was a Zoom meeting with the clinical director where we will talk about the topics we were planning to cover. There was time for feedback and listening her suggestions and requests. She requested a brochure and samples of products if possible. The college provided some samples to give away, but it would have been nice to have samples directly from companies, because the college can only give us some compared to companies who have the ability to give away more and more variety. Another biggest limitation was the fact of the delayed response from the Health and Wellness Director. For future experiences, we'll create an effective way to get donation from the big companies that manufacture dental care products in order to provide a range of variety and abundant samples. Another biggest limitation was the fact, the anterior please. Thank you. Of the delayed response of the person that the Health and Wellness Director derived as since the beginning. Thank you. Next. In our outcomes, despite the limitations experienced during the process of this educational program, we obtained very satisfactory outcomes. After receiving the surveys from the participants, members of the staff, we found that the main objective of the program was reached. The participant staff members considered that the information received was useful for their role and that they will include and use this information with their patients. As well, the participants rated students' knowledge in this topic as excellent. Most of the participants found that they learned new information, and they recommended that this kind of activity should be more frequent to keep their information updated. This is the example that of the survey that we sent to the participants to collect their feedback. Conclusions. Performing this activity has been a gratifying experience as a group and as a future dental hygienist. Being part of the community and giving some of our knowledge, not just in benefit of our clients on the dental chair, but collaborating with other healthcare providers in the interest of the public, and in this case, a population in need. Thank you so much.